How does cognitive behavioral therapy change criminal behavior in corrections? Imagine a person who keeps making the same mistakes, even when they know better. Now picture a way to help them see their choices differently and change their actions. That's what cognitive behavioral therapy does in the world of corrections. It focuses on helping offenders understand how their thoughts influence their behavior. When someone commits a crime, it often stems from distorted thinking patterns or emotional struggles. Cognitive behavioral therapy aims to identify these harmful thoughts and replace them with healthier ones. In correctional settings, this therapy teaches offenders skills like problem solving, anger management, and self-control. For example, a person who justifies their criminal acts might learn to see the real consequences of their actions. They learn to challenge those justifications and consider more positive ways to handle problems. The therapy also encourages behavioral practice, like role-playing, to reinforce new habits outside of sessions. Offenders might be given homework to practice these skills during their daily lives. The success of cognitive behavioral therapy depends on several factors. When trained facilitators follow a structured program, results tend to be better. Programs that target high-risk offenders who are more likely to reoffend often see stronger improvements. The therapy works best when delivered consistently, such as 2 sessions a week over several months. During this time, offenders learn to control anger, develop better interpersonal skills, and manage stress without turning to crime. Research shows that cognitive behavioral therapy can cut reoffending rates by about 50% when done properly. It is especially effective for young offenders and those with substance abuse issues or violent histories. However, for sex offenders or domestic violence cases, results can vary. Also, if therapy ends at prison and there is no follow-up support after releases, the long-term impact may be limited. From a true crime and criminology perspective, cognitive behavioral therapy marks a shift from punishment to rehabilitation. It targets the root causes of criminal behavior, giving offenders tools to change their thinking and actions. When integrated with other support services like employment and housing assistance, it can help reduce the chances of reoffending. In the end, cognitive behavioral therapy works by reshaping how offenders think and behave. It provides practical skills to avoid crime and build better lives. When implemented well, it can lower repeat offenses, making communities safer and helping individuals turn their lives around.